Have you had your vaccination shots? Well, I hope you have, because right now there has been a measles outbreak in parts of the US and other parts of the world. And for today's episode of CARICOM One-on-One, we're going to be talking with the head of the Caribbean Public Health Agency, Dr. James Hospedales, about the measles outbreak, about vaccinations, why do we need to get vaccinated, and so on. So I have him here with me today. Welcome to the program, Dr. Hospedales. But before we start this conversation, if you are not yet a part of the CARICOM YouTube family, go ahead and subscribe to our channel. And if you want to know when we upload, hit that bell notification button. Now, Dr. Hospedales, let's talk about vaccines and vaccination. What is I know it's an injection, but what's the purpose of it? What is a vaccine?
Well, thank you and good afternoon to all. Vaccination is protection for all ages, from infants to elderly people, protecting us against a lot of diseases that have killed and maimed people over the generations and centuries. When I was at medical school, we used to have hundreds of children being admitted with measles pneumonia, with measles encephalitis, and malnutrition caused by measles and deaths caused by measles. So I respect measles. I was happy when in 1991, I was a junior at CAREC at the time. I learned that we could possibly prevent this through vaccination, and we got the authority from the Council of Health Ministers to launch a program to plan and execute a big bang campaign. In May 1991, we've vaccinated 2 million of the region's children under the age of 14. And you know what? Transmission of measles stopped.
Wow.
That means every year, thousands of children don't get it, don't go to hospital, and don't die. So I count the benefit and the blessing of vaccination to protect us from measles and other diseases.
Right. What are some of the other diseases that you can get vaccinated against?
Well, most people in the Caribbean should be familiar with and proud of our vaccination programs. We have led the world to eliminate measles. Some of the other key diseases would, of course, be your diphtheria, your whooping cough, tetanus. You should always make sure your tetanus shots are up to date, no matter what your age. Measles, mumps, rubella. We've also eliminated rubella or German measles. So that way for a child to get a birth defect, so that has been eliminated. That's a great plus to the region. And then there are other more up-to-date vaccines for rotavirus, for hepatitis B, for human papillomavirus. There's a good dozen diseases that we can prevent and avoid the suffering, which I think is better than getting the problem.
Right. So if this is such a good thing and this can prevent us from getting or contracting certain diseases, why is it that some people are hesitant to get vaccinated?
That's a good word. I think for various reasons, including misinformation, but genuine concern about side effects. When you're no longer seeing the disease, say measles, and the fact that it can cause pneumonia and put you in hospital and kill you, then you become less afraid of that, and you may be more afraid of some of the side effects, some fever, some aches and pains, and people begin to hesitate and maybe even completely not take the vaccine, and that is a mistake, and I'll tell you why. Because when you do that, you let down the guard of everybody else. You create pockets in our population where the children are susceptible, they're not immune, and if measles is introduced, then you can get an epidemic and you can get these problems coming back. We have, thank God, in the Caribbean, through our good programs, avoided measles coming back into this region. But our defenses are being tested.
Because we've seen it come
tourists coming in from Europe. We have North America now. We have Venezuela and people coming from Venezuela in large numbers because of their situation, and they've had a measles outbreak. So Latin America, North America, Europe, it's almost like we're besieged.
Oh dear.
And that's why I say our programs are strong, because so far all the imported cases, they have been found, traced, all the testing done, and so measures put in place, and there's been no secondary spread. So that's a good sign of our programs being good.
Okay, so that means then there isn't really a cause for us in the region, because I'm pretty sure that persons might have some concerns about this outbreak that is currently happening, and they want to know, well, can we be affected in the CARICOM region? What is being done to prevent that if we need to put measures in place?
We can be infected. We are at risk. As I just said, many of the places with whom we have a lot of contacts. Europe, 50-something thousand cases last year. The United States, Latin America in the last year have had measles and are still having it. By definition, with the amount of travel we have, we're at risk. We reduce that risk by making sure our vaccination coverage and our population is protected. We reduce that risk by working to inform people that if you develop fever and rash, go to the doctor, go to the health center.
Right.
And we have monitoring mechanisms and rapid testing mechanisms to confirm whether somebody has this or doesn't.
Okay.
The hotel and tourism industry, we've been working to brief that sector because
Right.
they're on the front line. So those are some of the measures that are taken.
Right, but we can safely say that a majority of the CARICOM population is vaccinated against these diseases and these illnesses.
That is correct. Our biggest concerns would be those pockets and populations where people, for whatever reason, maybe the vaccination hasn't reached them, or this issue of vaccine hesitancy has crept in, and people have been delaying or not had. They need to get their children vaccinated and protected, and protect everybody else as a result.
Okay. Thank you, Dr. Hospedales, for sharing with us about this issue. I'm sure that those concerns that persons have about these illnesses, I hope there have been allayed. And thank you also for joining us for today's program. If you have not yet been vaccinated, or if your children have not been vaccinated, it would be a wise choice for you to go ahead and get that done. If you are not a member of the CARICOM family, I once again invite you to subscribe to our channel. Go ahead and hit that bell notification button. Like us on Facebook, follow us on Twitter, check out our blog at today.caricom.org. And if you want to know more about CARICOM's projects, our activities, then go ahead and check out our website at www.caricom.org. Once again, thank you for joining this episode of CARICOM One-on-One, and we look forward to seeing you next time.